Hi, this is Barbara Davey submitting Task 2 for course YJT Elements of Effective Communication, Western Governors University. Oh, I just hope one day I'll be normal again. The wit, the comprehension, the attention, it's not there anymore. It's been 10 months, and I keep waiting for things to get better, but nothing happens. This is a patient testimonial obtained by Dr. Wesley from Vanderbilt University. Research suggests that ICU delirium is often unrecognized, misdiagnosed, and misunderstood because an assessment tool such as the confusion assessment method for the ICU or the CAM ICU is not used, and the importance of early recognition and diagnosis of delirium in preventing possible long-term cognitive disabilities and mortality. The main points I will discuss today are the use of the CAM ICU tool and the importance of early diagnosis and intervention for patients that score positive for delirium. Rebecca Boots, in her 2012 article titled Delirium, A Nurse's Role in the Intensive Care Unit, states that the CAM ICU tool is a valid and reliable assessment tool when used by nurses that have been properly trained and educated in its use. Lee Cutler did a YouTube video in 2010 titled CAM ICU, in which he describes the 4 elements of the assessment and how each area is assessed. The first area or element is a change in mentation within the past 24 hours. If a patient that had normally been alert and oriented suddenly becomes restless or stupors or withdrawn, the patient would score positive. If there's been no change, the patient would remain negative for the CAM ICU. For inattention, you would instruct the patient that you're going to repeat a series of letters. And each time you say the letter A, they are to squeeze your hand. An example would be SAVEA, HAART. If the patient has more than 2 errors, they score positive for CAM ICU. However, if they have fewer than 2 errors, they would score negative. If your patient scores negative for a change in mentation within the past 24 hours and inattention, you could stop your CAM ICU assessment at this point. However, if the patient has scored positive, you progress to element 3, which is altered level of consciousness. If the patient is anything but alert and oriented, the patient scores positive. The 4th element, disorganized thinking, involves 2 areas. Number 1, you will ask the patient 4 simple questions, and these questions are: does a rock float on water? Are there fish in the sea? Does 1 pound weigh more than 2 pounds? And can you use a hammer to pound a nail? If the patient scores greater than 1 error, they score positive for the CAM ICU. The second portion is asking the patient to follow a command. While standing in front of the patient, you hold up 2 fingers. You ask the patient to do the same, and then you ask them to do the same with the other hand. If for some reason they're not able to use the other hand, then you ask them to hold up an additional finger, so they would need to hold up 3 fingers. If they're not able to follow the command or complete it, the patient scores positive. In scoring the CAM ICU, to be positive, you would be positive for change in mentation within the past 24 hours, positive for inattention, and or altered level of consciousness and disorganized thinking. If the patient scores positive, then the patient is suffering from delirium. This is an example of a CAM ICU worksheet that the nurse may use in her daily assessment for delirium. This worksheet covers the 4 features and aids the nurse in diagnosing delirium. This was obtained from Dr. Wesley at Vanderbilt University and is used at used by the bedside nurse. Christina Caballero from the University of Texas, in her 2010 article titled "Treatment of ICU Delirium, Is It Time to Stop Being Typical?" reports that undiagnosed delirium is the #1 risk factor for long-term cognitive impairment and mortality. Karen Whitehorn's November 2015 article in the American Journal of Critical Care Nursing titled "Lived Experiences of the Intensive Care Units for Patients that Suffer Delirium" report a few common themes. One theme is that the patient just can't remember their stay in the intensive care unit, and they rely on family members and friends to fill in the gaps. Oftentimes, this brings feelings of guilt, embarrassment, and shame to the patient because they have no recollection of ever behaving in that manner. A second recurring theme is, "I couldn't get it straight." By this, the patients report that they're not sure if they are awake or if they're dreaming. One patient recalls seeing yellow monkeys hanging from the lights above her bed. Another patient wasn't sure if they were in a nightclub. One patient even thought they were in the beauty shop. Heather Worland, in her June 2015 article titled "Post-Traumatic Stress Syndrome Associated with Stays in the ICU," report that patients feel as though they suffer from post-traumatic stress syndrome. They often have flashbacks of events that happened during their stay. This is very disturbing to the patients, and their families often do not understand how this could be. They're a different person following the recovery from a critical illness. According to Christina Caballero from the University of Texas, for each day a patient suffers from delirium, there is a 10% increased chance of mortality. And those patients that suffer delirium have 3 times the 6-month mortality compared to patients that had not experienced ICU delirium. This is a list of references used to complete my task. Today I discussed the importance of using a valid and reliable assessment tool such as a CAM ICU for early diagnosis of ICU delirium, and the importance of the nurse recognizing ICU delirium in helping to prevent possible long-term cognitive disabilities and increased chance of death. As nurses, we want to do what is best for our patients, especially our critically ill patients who are dependent upon us. A simple test and tool available for use, the CAM ICU, should be incorporated into the daily routine. Early diagnosis may prevent long-term cognitive disability and may increase the patient's chances of survival. If it was our family member in the intensive care unit, we would want a nurse caring for our loved ones that is educated and trained in the use of the CAM ICU so that our loved one has a decreased chance of long-term cognitive impairment and an increased chance of survival.